Welcome back, everyone. That was a great talk by Dr. Brunson. And at this point in time, we're going to head over into our session one. So I'd like to introduce Dr. Jesse Pizarro, who's the Associate Professor of Criminology and Criminal Justice at the Arizona State University and a member of the FACTS team, who will introduce our first session on community violence, structural racism, and policing. Welcome, Dr. Pizarro.
Good morning. I'd like to welcome you to this mini symposium session on community violence, structural racism, and policing, understanding disparities in firearm outcomes. I am pleased to introduce this session on disparities in firearm outcomes. Our country is currently facing persistent racial disparities in firearm violence and challenges with police violence that can erode community trust. Today's session will explore some of the factors underlying these disparities and examine how these disparities have evolved since the start of the COVID-19 pandemic. At this time, I would like to introduce our presenters. First, Dr. Nicole Kravitz-Wirtz. She's an assistant professor at the University of California, Davis and FACTS faculty member. She will present work on disparities in exposure to deadly gun violence at the community level and related neighborhood characteristics. Next, we have a presentation from Dr. Rebecca Sokol, an assistant professor at Wayne State University and also a FACTS faculty member. Dr. Sokol's presentation explores how perceptions of police bias may influence the association between perceived community violence and firearm carriage. Then we have Dr. Xingfeng Xie, research investigator at the University of Michigan, who will present her research examining the effects of exposure to increased racism since the COVID-19 pandemic on Asian American firearm behavior and injury risk. Finally, Rachel Martin, MPH student and research assistant at Boston University, will speak about racial disparities in exposure to firearm violence and how these disparities have evolved since the start of the COVID-19 pandemic. After we have heard from the presenters, we will have time for questions. If you would like to submit a question, please use your Q&A feature located in the bottom menu of your screen. We encourage you to send in your questions before we reach the end of the presentation, and we will do our best to answer as many questions as possible. At this time, please share. At this time, Dr. Kravitz-Wirtz, please share your slides.
All right, good morning, everyone, and thanks, Jesse and the FACTS team for creating this space where I can share some of the initial results from a larger study focusing on community exposure to deadly gun violence among youth in large US cities. Next slide, please. So first, I just want to quickly acknowledge my collaborators on this project, which includes Dr. Angela Bruns at Gonzaga University, who's my co-PI on this work, along with the rest of our research team at UC Davis, which includes Dr. Shawnee Buggs, Amanda Abel, who will be presenting some other work later today, as well as Xiaoya Zhang. And we have no conflicts of interest to disclose other than our funding from the CDC. Next slide, please. So exposure to gun violence can take many forms, as we know. And so for this project, we've conceptualized these different facets of exposure using this gun violence exposure pyramid. Next, please. And at the tip of the iceberg, or at the tip of the pyramid here is perhaps the most obvious and best measured facet of exposure, specifically victimization or involvement with gun violence, or so-called direct exposure. And this group knows better than anyone that firearm homicide is a leading cause of death for children and teens in the US, resulting in roughly 2,000 deaths or 5 lives lost per day in 2019 alone, with disproportionate impacts on Black and Latinx youth who respectively have around 14 times and 3 times higher rates of death due to firearm homicide than their white peers. And while the data on non-fatal shootings is less definitive, research suggests that non-fatal shootings tend to outnumber fatal shootings by a factor of around more than 2 to 1. Next, please. So a level up here in the pyramid is indirect exposure in the form of witnessing a shooting or hearing gunshots. And national survey data suggests that 13% of teenagers have heard gunshots or seen someone shot in their lifetimes. And in communities highly impacted by structural and interpersonal violence, this percentage is closer to 60%. And when it comes to both direct and indirect exposure, we know that health and social consequences for young people can be substantial and wide-ranging, from PTSD, school problems, and substance use to elevated levels of self and other directed violence risk. Next, please. And yet direct and indirect experiences of gun violence are just the tip of the iceberg when it comes to thinking about the full spectrum of gun violence exposure. Gun violence doesn't only happen to people, it happens to places, and there's growing recognition that exposure and resulting trauma can extend beyond the individual and affect an entire community. And that's why in this project, we're focusing on so-called community exposure to gun violence. And community exposure occurs when someone is socially proximate to and or lives or spends time in places impacted by elevated rates of gun violence, regardless of whether they witness or experience the violence firsthand. This expanded view of community exposure to gun violence is conceptualized as collective in nature, and it can leave indelible marks on a community's consciousness via its negative effects on the structures and social ties important for daily life and healing. So with respect to social proximity, we know from past research, for example, that police killings of unarmed Black Americans are significantly associated with nearly 2 additional poor mental health days per person per year among other Black Americans living in the same state. And when it comes to residents in violence impacted communities, Patrick Sharkey and others have shown that occurrence of an incident of violent crime near a young person's home in the week before administration of a standardized test reduces test passing rates by 3 percentage points, regardless of whether students witnessed or experienced the violence directly. And yet, aside from these sort of few studies, which have generally relied on small or geographically restricted populations and haven't focused specifically on violence involving guns, we have very little sense of the population prevalence of community exposure to gun violence, because self-report survey data relies obviously on firsthand accounts, and there's no harmonized national database of incident level violence data for widespread use in population research. Next slide, please. And actually, next slide. To address this gap, our first aim in this project was to establish a basic foundation by estimating the frequency of community exposure to deadly gun violence occurring within various distances from young people's homes and within various timeframes throughout a year overall and by race ethnicity, as well as to examine the nexus of this community exposure and socioeconomic characteristics of the household and residential environment. So our data come from the 6th wave of the Fragile Families and Child Wellbeing Study, which is a population-based cohort study following a sample of families with children born in and around the year 2000 in 16 large US cities. And at the 6th wave of follow-up, which was administered in 2014 through 2017, focal children were about 15 years of age. And so the Fragile Families data have a number of strengths that make it particularly well suited for our objectives in this project. But most of all, the administrators of the study recently linked residential address information for families in the 6th follow-up wave to incident level data on gun homicides using information from the Gun Violence Archive, which, as many of you know, is a national open source database of incidents of gun violence and gun crime for the years 2014 onward. So our analytic sample with this linkage includes approximately 2,500 youth. And here we just use standard descriptive techniques to generate population estimates of the prevalence of community exposure to gun homicides at various cross tabulations of distance from their homes and by various timeframes prior to the Wave 6 interview. And all estimates are weighted to be statistically representative of youth in large US cities. Next slide, please. So we conceptualized youth community exposure to gun homicides as living within 600, 800, or 1,300 meters respectively of an incident in which an individual was killed with a firearm as a result of interpersonal violence in either the 14, 30, or 365-day period before youth were interviewed at study wave 6. And these measures generally approximate the radius of census block groups, the subjective perceptions of a typical neighborhood, or at 1,300 meters census tracts. Next slide, please. So we also construct a measure of neighborhood socioeconomic disadvantage from a principal component analysis of 6 commonly used census tract level items, as well as measures of neighborhood collective efficacy. And then we also include youth self-reported race, ethnicity, and the poverty status of their household. Next slide, please. So this table summarizes our distance by recency estimates of community exposure to gun homicides among youth in large US cities. And so as shown, 2% to 18% of youth resided within 600 meters or less than half a mile of a deadly gun violence incident occurring within the past 2 weeks to 1 year. These percentages were 3% to 25% when examining the exposure radius, or when expanding the exposure radius to 800 meters, and then 5% to 37% when considering a 1,300 meter exposure radius surrounding their home. So extrapolating to the population of youth in large US cities using the study's survey weights suggests, for instance, that in the case of past year exposure to gun homicides within 1,300 meters of home, we're talking about an estimated 400,000 impacted young people, which is just astronomical orders of magnitude more than the number of young people who witness or experience gun violence directly. Next slide, please. So not surprisingly, past year community exposure to gun homicides within 1,300 meters of home was more frequent among Black and Latinx youth, young people in lower income households, and those who reside in neighborhoods characterized by structural disinvestment and social disruption. Next slide, please. And one more, please. So now it's well known that neighborhoods in the US tend to be segregated by race and socioeconomic position due to institutional racism and other systemic barriers that have been codified in past and current policy. And as a result, structural adversities tend to be disproportionately concentrated in low-income Black and Brown communities. And so we wanted to look at the nexus of race, household poverty status, and neighborhood socioeconomic disadvantage. And so what we see here is that the percentage of white youth who reside in the most disadvantaged neighborhoods is considerably less than all other racial ethnic groups, regardless of household poverty status. Next slide, please. Thank you. Now this slide shows the predicted probability of community exposure to gun homicides at the intersection of race, household poverty status, and neighborhood disadvantage. And the gray panels reflect categories of household poverty from low to high. And within each panel, the different sets of estimates represent different levels of neighborhood disadvantage from low to high. And finally, the different colors reflect categories of race ethnicity. Next slide, please. So we see here that within each category of household poverty, from higher income on the left to low income on the right, there's a steep upward gradient in a young person's chance of community exposure to gun homicides. For instance, Black and Latinx youth in high income or high poverty households who live in the most disadvantaged neighborhoods have roughly an 80% chance of past year exposure to a gun homicide occurring within 13 meters of their home. And among white youth, it's a 62% chance. So I know I'm running short on time here, so we can go to the next slide. And I'll sum up, so we can go to slide. You can keep going here. All right, so this is, I'll conclude here just to say that I think there's a few overarching takeaways. And so first of all, data limitations have until recently severely limited our ability to capture the full spectrum of community exposure to gun violence. And this in turn appears to have led to critical underestimates of who is touched by community gun violence and potentially unduly limited the reach of necessary efforts to address trauma and other consequences of gun violence exposure in all of its forms. And so to that point, the next steps in this larger project are to investigate using propensity score matching methods, the socio-emotional health and behavioral effects of community exposure to gun violence among youth, as well as heterogeneity in such effects in order to identify modifiable points of possible intervention to reduce or prevent additional firearm-related harm. Thanks so much.
You're on mute.
Thank you so much. I forgot. So good morning and thank you for attending this session. In this talk, I will be talking about some research that colleagues and I conducted on the association between perceived community violence, police bias, race, and firearm carriage among urban adolescents and young adults. Next slide, please. As we know, firearms are a leading cause of injury and death among adolescents and emerging adults. 2/3 of all violence-related deaths among adolescents and emerging adults are from firearms. And community-based programming and policies can reduce this burden, but understanding the context under which youth are motivated to carry firearms is an important step in informing such programs. Next slide, please. Centered on this slide is an image of youth firearm carriage. Researchers have established time and time again that youth firearm carriage is an important predictor of what we see on the right of this screen, which is firearm-related injury and death. Researchers have also found that perceived community violence, displayed in the left image, is an important predictor of youth firearm carriage. And now in the present research, we honed in on this relationship between perceived community violence and firearm carriage to understand what factors influence the strength of this relationship. Next slide, please. We first hypothesized that the positive association between perceived community violence and firearm carriage is strengthened in the presence of perceptions of police bias. We posited that when individuals feel that they cannot trust police to protect them, they have a heightened sense to protect themselves and are thus more likely to carry a firearm. Stated another way, legal cynicism, or perceiving the law as illegitimate, unresponsive, and ill-equipped to ensure public safety, may motivate the carriage of a firearm for protection, especially when an individual perceives ongoing community violence. And now this hypothesized association, whereby the association between perceived community violence and firearm carriage is stronger when perceived police bias is greater, may differ across racial groups. So although many non-Black Americans are aware or becoming aware of the presence of police bias, the negative repercussions of non-responsive police are stronger for minority populations, particularly Black Americans. Black Americans have disproportionately experienced police violence, and Black men are 2.5 times more likely to be killed by police over their lifetime compared to white men. So white citizens, even if they have negative perceptions of police, may still be able to rely on the police for some level of protection. So thus, we further hypothesized that the proposed moderated association between perceived community violence and firearm carriage by perceptions of police would be stronger for Black citizens compared to non-Black. Next slide, please. So to summarize, our two hypotheses were that the association between perceived community violence and firearm carriage is stronger in the presence of higher levels of perceptions of police bias. And then our second hypothesis was that this moderated association was stronger for Black citizens. Next slide, please. So in this present study, we used cross-sectional screening data from a larger intensive longitudinal daily study of firearm behaviors among adolescents and young adults seeking urban emergency department care in Flint, Michigan. So the study team, led by Dr. Patrick Carter, approached individuals aged 16 to 29 years old who presented to Hurley Medical Center Emergency Department for any reason. And this was between July 2017 and June 2018. The final analytic sample for the study included 1,296 individuals, and key study measures included perceptions of community violence. And this was measured using items from the Things I Had Seen and Heard survey, perceptions of police bias, which was a summary score from several items from the perceptions of police scale, race, which was we dichotomized into Black and non-Black, and firearm carriage, which was a dichotomous variable that captured whether or not an individual carried a firearm in the past 3 months. And we also identified a set of potential confounding variables that we identified through a directed acyclic graph. Next slide, please. We use multivariate Poisson regression models with robust error variance to examine the relative risk of community violence exposure on firearm carriage. So for addressing hypothesis 1, we regress perceived community violence exposure, perceptions of police, and control variables on firearm carriage. And we included an interaction between perceptions of police bias and perceptions of perceived community violence. Then to address hypothesis 2, we added in a 3-way interaction between community violence, perceptions of police, and race. And of course, all lower order interaction terms. We then conducted a likelihood ratio test to assess if model fit improved between the first and second model. An improvement in model fit would result in the adoption of the hypothesis 2 model as the final model. Next slide, please. Model fit did not significantly improve between the 2 models. So adding a 3-way interaction between community violence, perceptions of police, and race did not improve model fit. So what we did was we did not retain that 3-way interaction in the final model. And so we interpret results here from our first model that regress perceived community violence exposure, perceptions of police, and control variables on firearm carriage, including the interaction between perceived community violence exposure and perceptions of police. This table presents the results from our first model with adjusted relative risks in the first column and adjusted average marginal effects in the second column. Average marginal effects are the difference in average predicted probability of firearm carriage between the group of interest and the reference group for categorical variables, or the difference in average predicted probability of firearm carriage associated with a 1-unit increase in the variable of interest for continuous variables. So for example, an average marginal effect of 0.05 indicates a 5 percentage point difference in the predicted probability. And now, as illustrated in this table, every 1 standard deviation unit increase in perceived community violence was associated with a 5 percentage point increase in the predicted probability of firearm carriage, showing that perceived community violence and firearm carriage are indeed associated. Identifying as Black compared to non-Black was not associated with predicted probability of firearm carriage. But as seen in the adjusted relative risk for the interactions, we also found a significant interaction between community violence and perceptions of police bias and the association with firearm carriage. Next slide, please. Decomposing the nature of this interaction, the positive association between community violence and firearm carriage increased with higher levels of perceptions of police bias, illustrated in this figure. So for example, at low perceptions of police bias, which is 1 standard deviation below the mean, which is the dotted line in the figure, the average marginal effect of a 1 standard deviation increase in perceptions of community violence was a 2.8 percentage increase in the predicted probability of firearm carriage. So this average marginal effect rose to a 4.5 percentage point increase and a 6.5 percentage point increase and the predicted probability of firearm carriage at average, which is the dashed line in this figure, and high levels, which is the solid line in this figure, above the of perceptions of police bias. Next slide, please. So there are some limitations of this study, including it's a cross-sectional study, and it's thus we're unable to infer causation. The sample was also drawn from a single urban emergency department, and so future studies are needed to investigate if these relationships exist in other contexts and in other cities throughout the country. But overall, this study does provide some important findings. Specifically, the association between perceived community violence and firearm carriage appears to be moderated by perceptions of police bias in high crime urban settings. And programs are needed to reduce police bias, and community level prevention strategies are now also needed to reduce violence exposure overall in order to try to reduce the rates of youth firearm carriage in these settings. Next slide, please. And I would just like to thank the funders for this work, as well as as well as Kanisha Wallace and Sonia Kamat for their assistance with data collection and preparation, and of course, the patients and medical staff of Hurley Medical Center, in addition to the co-authors for this work. Thank you.
Good morning, everyone. Very excited today to be able to come here and share with you this very much understudied topic, which is racism against Asian Americans and how that would link to mental distress and firearm outcomes among this community during the COVID-19 pandemic. Next slide, please. Why studying Asian Americans? We oftentimes hear that Asian Americans are less likely to be violent and less impacted by firearm injury or mortality. Well, this statement may not stay true after the pandemic. Since the past year, almost 3,800 racism incidents have been reported by Asian Americans, and we all know this is a huge underestimate if you think about their daily experience of racism and discrimination. And the hate crime against Asian Americans also increased in the beginning of 2021. It's already twofolded against this community. And with the Atlanta spa shooting, there's a massive media coverage. And then as a result, there's a huge, tremendous fear sensed by this community, and they're eager to seek for protection and a sense of safety. Also, what's emerging is their concern of mental health. We know that among Asian Americans, if they experience racial trauma or mental distress issues, they are 3 times less likely to seek for help compared to any other race group. Next slide, please. And so understandably, we have noticed that there's an increase of firearm purchase nationwide by this Asian American community. If you Google search it, you'll see numerous news reports on that and stories about it. However, we could not find any data to really support that, given the limited data access. And we also know that pro-gun lobby and firearm industry have now been focusing on Asian American as their new marketing strategy. They want to leverage the sense of seeking for protection. They want to leverage that for encouraging firearm purchase. Given all that, yet we found no research that have examined how racism against Asian Americans may have influences on both mental health and firearm outcomes. Next, please. So that leads to our study in collaborating with Dr. Zuing Wu in Eastern Michigan University. We want to answer these 2 questions. First is to examine whether racism experienced by Asian Americans may link to firearm risk and increased firearm purchase. And secondly, we want to take a further look into mental distress and how mental distress may play a role in that relationship. Next, please. So we reached out to Dynata, and they have this panel called Simplify that consists of about 2.5 million US residents. It's a non-probability quota sample, and we're able to draw participants from that panel. Within a 2-month period, we recruited about 916 Asian Americans. Within that sample, we have about 60% female participants, and we're able to have these 5 Southeast and East Asian group participating in our study, which include Chinese, Filipino, Japanese, Korean, and Vietnamese. Next, please. So to collect the data, we use Qualtrics online survey. It's a one-time point data collection, and we asked them to complete this survey during December 2020 to January 2021. And in the survey, we try to assess different aspects of racism experience. We assess the racial discrimination and in a variety of settings. And we also ask participants about their perception of cultural racism, how Asian Americans are depicted negatively on the media and social media. And then we ask them questions about anticipatory racism-related stress, which is essentially the psychological and behavioral reactions to expected racism. And then finally, we ask one question about to what extent they feel unsafe because of their race. With that, we use the racism experience as the predictor in our model, and we assess mental distress using the patient health questionnaire to evaluate their value of anxiety and depression level. And then finally, we focus on 2 firearm outcomes. One is the firearm purchase, gun purchase or ammunition purchase since the pandemic. And then secondly, we focus on firearm risk, which we define it as unsafe storage and carriage. And then to analyze the data, we use latent factor structural equation modeling. Next, please. And this very first result slide represents the result focusing on firearm purchase. We use a score of 0 to 2, where 0 representing they did not purchase any firearm or ammunition, and 2 represent they purchased both a gun and more ammunition since the pandemic. And then we initially just look at the direct relationship between racism and purchase, and then we enter mental distress as in the second model to see the model fit improved. And in this model, we're able to see the model fit improve, and also the indirect path through the mental distress was significant. So it's a partial mediation model you're seeing here, where racism have directly predict the increase of purchase, but also indirectly through mental distress. We're able to control for the demographic factors and also their prior history of owning, individual owning or family owning guns. Next, please. And then this second slide focusing on the firearm risk. Like I mentioned, it's defined as unsafe storage. So if they store the firearm unlocked or loaded, then they got a score of 1. Or they, if they answer yes, that they carry a gun more frequently since the pandemic, then get a score of 1. And the outcome variable is the sum of the 2. And then for this similar model, we were not able to find that mental distress being a significant mediator. So that indirect path was not significant. However, we do still see that racism experience can increase the firearm risk. Next, please. So to conclude, I think there are 3 main key takeaways. First, we do see in our data that there's a support that increased racism experience is associated with increased mental distress, increased firearm purchase, and an increased firearm risk. And then if you take a further look of the role of the mental distress, we see that it links to greater exposure if you especially think about from the perspective of the firearm ownership. In the future, it will be really interesting to see, figure out more way to investigate this intersectionality between mental distress and firearm ownership. And then finally, this is a cross-sectional data. So we were not able to make any temporal interference or causal interference, but in the future, we'll love to have more access to longitudinal data, as we now know this is an emerging issue for our Asian American community. And also, we would love to focus more on the resilience factors that will be more protective for this community. Thank you.
Hi, everyone. My name is Rachel Martin, and I'm a Master's in Public Health student at the Boston University School of Public Health. And today I'm going to be talking to you about racial disparities in child exposure to neighborhood firearm violence before and during the COVID-19 pandemic. This project was funded by the Boston University Undergraduate Research Opportunities Program in collaboration with the Research on Innovations for Safety and Equity, or RISE Lab, at the BU School of Public Health, led by Dr. Jonathan Jay. And I first just want to thank you all for being here and for this opportunity to speak with you all today. I'm very honored and excited to be here. Next slide. So as we know, gun violence persists as a major public health and safety crisis in the US. About 100,000 Americans are injured with a firearm every year, and over 17,000 of these people are children. Firearm violence has also spiked since the beginning of the COVID-19 pandemic in 2020. And COVID has also exacerbated a range of social disparities, which makes examining racial disparities in firearm violence perhaps more important than ever. And exposure to firearm violence can occur through various pathways of indirect exposure, for example, witnessing or hearing an incident of firearm violence, living in a community where violence is common, losing a family member or a friend to firearm violence. And exposure can also occur directly, such as being killed, injured, or directly threatened with a firearm. And while this wide range of exposure types is not always considered when investigating exposure to firearm violence, all of these exposure types can have adverse mental, physical, and emotional effects through the course of a child's life. Long-term community violence exposure also contributes to collective community-wide feelings of hopelessness and disorganized social networks that can promote or cause even further violence. And researchers have identified racial disparities in these exposures to firearm violence. Children of color, particularly Black children, experience the highest rates of exposure to serious incidences of violence in the US, and because such strong racial disparities exist, adverse child outcomes in terms of physical, mental, and emotional well-being are reinforced even further. Next slide, please. So for this study, our team's main objectives were to estimate racial disparities in child exposure to neighborhood firearm violence in the US, and to estimate the effects of the COVID-19 pandemic on these disparities. Understanding racial disparities in exposure is incredibly important for informing policy decisions and protecting at-risk children from the adverse effects that exposure to firearm violence can have. And because of the timeliness of this subject, little work has really documented changes in child exposure to firearm violence and racial disparities during the pandemic thus far. Next slide. In terms of methods, our approach measured neighborhood exposure to firearm violence by estimating the number of firearm violence incidents in the home census tract for a given population of children over time. And we used firearm injury data from the Gun Violence Archive, which is a nonprofit that uses media reports and other publicly available sources to track shootings in the US. And we used population data from the US Census to obtain the estimated count of children ages 5 to 17 for 8 racial categories. Our team then geocoded each incident of violence based on the location given by the Gun Violence Archive and matched these locations to census tracts for every census tract in the US. And the time period of study was pandemic years, beginning on March 15th of each calendar year and ending with March 14th of the following year to eliminate seasonal trends and look solely at comparisons within the first year of the COVID-19 pandemic. And our control variables in this study were poverty rate and housing vacancy rate to assess how social disadvantage structures disparities. And we ran our analysis with and without these control variables to see how much of the disparities the controls explain and what is unexplained by the controls alone. Next slide. And all analyses were focused on estimating and explaining racial disparities in neighborhood firearm violence exposure rates. So for model-based assessments, we analyzed fatal shootings as a function of child racial composition and used white children as the reference group, including the COVID-19 pandemic year indicator to assess the effects of the pandemic. Next slide. And after all of our analyses, our final sample included over 58 million children ages 5 to 17. As you can see, the figure on the right is displaying mean annual firearm homicide incidents in home census tract by child race. And this chart displays the trend in changes in firearm violence exposure over time, showing that the incidents stayed relatively stable from 2015 to 2019 and increased in 2020, along with a large jump in disparities between white and non-white children. And before the pandemic in 2015 to 2019, we found that white children experienced the lowest amount of exposure to neighborhood firearm violence, and Black children experienced the highest amount of exposure. And once the pandemic hit in 2020, mean exposure rates increased for every racial group, and racial disparities increased as well during the pandemic, as there was a larger magnitude of increase in exposure for all non-white racial groups. And these disparities persisted even after controlling for elements of neighborhood level poverty and physical disorder, and for county level violence as well. Next slide. And just to provide a little bit more numerical context for our results, Black children exposure to firearm violence was 4.55 times greater than white children before the pandemic. And during the pandemic, there was an increase in exposure for all groups, including a 1.27 times increase in exposure for the reference group of white children. Additionally, there was an even larger magnitude increase in exposure during the pandemic for every other racial category except for Native American children. And this pandemic effect in terms of firearm violence exposure was 1.12 times greater for Black children than white children. Next slide. So some of the major limitations of our study were that we did not directly measure direct experiences of children's exposure to neighborhood gun violence. We instead used census tracts as the spatial unit of homicide to measure incidences of firearm homicide in a child's neighborhood, which is an imperfect measure of neighborhood violence exposure and limited our ability to draw conclusions about the direct mental and physical health implications of the exposures we measured. However, we don't necessarily need to have direct measures of exposure because children are often highly sensitive to neighborhood safety threats, and research has displayed adverse effects on children solely based on where violence occurred, regardless of if the child was directly aware of it. Next slide. So our findings from this study highlight needs for trauma-informed programs and mental health resources for children to address adverse mental and behavioral health outcomes for children. And these sorts of programs are generally delivered through schools and after-school programming, through mental health services, trauma-focused therapies, and support groups. Psychological first aid is another strategy that is used after a traumatic event to mitigate the impacts of trauma and help children to learn healthy coping mechanisms. And our findings also highlight a need for large-scale surveillance of firearms violence exposure and much larger scale structural reforms, community violence intervention by mediating disputes and connecting individuals with social services would be helpful in preventing violence, along with more large-scale upstream strategies such as greening vacant lots and demolishing abandoned buildings to address the impacts of physical deterioration and the physical environment with violence. And racial segregation is another fundamental cause of these disparities, and public policy that aims to reduce segregation could be helpful in addressing these issues. And overall, addressing these issues is very important as we begin to transition out of this pandemic and are faced with addressing the impacts that the spike in gun violence has had on adverse health outcomes for children. And it's really crucial that we protect children that have been impacted, particularly in the last year, to ensure a more safe and healthy future ahead for them. Thank you.
I would like to thank the panelists for this very informative session. We have some time for a few questions. Presenters, please turn your videos back on. Perfect. So I'm going to start with my first question for the first question that came in for Dr. Nicole Kravitz-Wertz. Building on the population prevalence estimates presented today in your talk, can you talk more about the next steps for the larger research project?
Sure. Yeah, thanks for that. So one of the things that we saw that I didn't get to underscore maybe as much as I'd have liked in the talk was the idea that we found that community exposure was really much more predicted by factors in the neighborhood environment. So structural disinvestment, social disruptions, really sort of shifted the rate at which young people were exposed to community violence, as opposed to the household level factors like household poverty status. When if we vary household poverty status, but look only within neighborhoods, we see much less variation. So one of the things we're interested in doing next is really assessing, sort of to the last presenter's point, the consequences of such exposure exposure, as well as some of the heterogeneity in those consequences, and what is accounting for such heterogeneity. Obviously, we know that everyone who is residing in neighborhoods highly impacted by structural and interpersonal violence doesn't experience the same consequences. What are the sort of the factors that are contributing to additional vulnerability or resilience? We saw, and again, I didn't get to quite show these results, but we saw that neighborhood collective efficacy was, as we know from past research, another factor that seemed to reduce and show strong downward gradients in the likelihood of exposure. So we're interested next in thinking about those, just the consequences in general, but more importantly, I think some of the heterogeneity and the factors that contributed to that heterogeneity, so that we can inform violence prevention and intervention strategies, probably mostly at the place-based as opposed to the individual level.
Thank you so much. The next question that came in is for Dr. Shea. And what kind of interpretation or theory you may have for the link between racism experiences and unsafe storage?
Yeah, that's a really good question. It's really intriguing too. So if you think about Asian American community living in such a fear and eager to seek for security, it's not hard to imagine how they would want to have readily access to firearm for some of them. So that kind of that's my interpretation of how we see the direct link between racism experience and unsafe storage.
Thank you so much. A question just came in for Dr. Sokol, and I'm going to paraphrase. It's a long question, but the person asked, it seems like efforts to increase homegrown officers will help with reducing police bias and increase the likelihood of police being more comfortable and friendly with their community. Did you have any other ideas or come across any solutions about what could help decrease police bias based on the work that you have done in this study?
Thank you for that question. I think it's a really good one. And something that the co-authors and I have been thinking about is community policing efforts as a potential way to both reduce perceptions of police bias and also hopefully reduce community violence exposure as well. And this type of policing is a more proactive strategy than a reactive strategy. Mm-hmm. So it involves police members working directly hand in hand with community members to identify priorities for the community, identify needs that the community has, and working hand in hand, really with the community members to, again, in that proactive strategy to try to curb crime before it emerges, rather than a more reactive approach. And that's actually one hypothesis for why we actually didn't find a three-way interaction in our model. So if you remember, our first model looked to see if the relationship between perceived community violence and firearm carriage was moderated by perceptions of police. And indeed, we did find that moderated association existed. And then we further hypothesized that moderation would be stronger for Black citizens compared to non-Black citizens. And we did not find evidence of that. And one of the post hoc kind of hypotheses why we didn't find that association was because this research study was conducted in Flint, Michigan, where community policing efforts have been in place for a few decades now. It was actually one of the first locations in the country where community policing was established. And so we were thinking, kind of post-analyses that might be a reason why we weren't seeing that three-way moderation, because community policing efforts were already in place and maybe hopefully reducing some of that disparity in police bias between Black citizens and non-Black citizens.
Thank you. The next question is for Ms. Martin. And the question is, why was census tract data utilized for quantifying exposure to neighborhood firearm violence rather than directly measuring experiences of exposure?
Thank you for that question. That's really good. I think the census tract data is helpful in being able to get a wider array of data. So we were able to track exposure for children across the country. And again, as I mentioned, because children often are affected by violence that they don't necessarily know is happening, the census tract is a good measure of data because it captures incidents that happen around them, even if they didn't directly know about it. So it still works as a good measure of exposure.
I was muted. Thank you. I have another question for Dr. Shea. And the question is, for carrying as a risk factor, did you delineate gun owners who had taken concealed carry training?
Yeah, for a short answer is no. In this initial data collection, we were not able to collect data for around that, but that is an awesome point. I would love to learn more about how to measure this aspect in the future research.
Perfect. I'm looking in to see if there are other questions. All right, I have one here. Wait, one just came in. So there's a follow-up question to that, Dr. Shea. Why is legal carry an at-risk factor, a risk factor?
I think this is really up to debate, and that's a great question. Why is legal carry a risk factor? For our data, we were not able to kind of differentiate whether it's a legal carriage or not. We do know it's a more frequent carriage by firearm owner. The only thing I could think of is the more frequent carriage may have association with more risk factors that surrounding firearm injury and mortality. So I hope that gets to that a little bit.
If I could jump in a little bit here from a criminological standpoint, we know that having a firearm legally or illegally regulated or unregulated, simply having a firearm increases the odds that you're going to use it. Is very routine activities, very rational choice theory. It creates the opportunity for usage. So just giving a little bit of a criminological perspective from my field. Let me check and see any other questions. Actually, there is one more, and I think this is going to be the last one. And this is for Dr. Sokol. Can you explain a bit more the interaction between perception of police bias and perceived community violence in its association with firearm carriage?
Yes, definitely. So what we found was that there is, kind of a baseline association between community violence exposure and firearm carriage. That's been well documented in research, and we reproduced those results in our study. So the higher an individual's perceptions of community violence, the higher likelihood that they're going to carry a firearm. And now we found that this relationship between community violence exposure and firearm carriage was stronger when individuals had greater levels of perceptions of police bias. So as an individual became more and more believed that the police were more biased, that relationship between community violence exposure and firearm carriage was stronger. So we see the strongest relationship between violence, perceived violence exposure and carriage for those individuals who have the strongest perceptions of police bias.
Thank you. That makes a lot of sense, and it's very helpful. At this point, there are actually no more questions. We have 2 more minutes. So last call for last questions. If not, we will conclude this session. So going once, well, is it going twice, going once? Great, no more questions. Thank you all for attending.